I am excited to welcome you all to the 2023 On With Life Neuro Rehab Conference. We are starting things off a little bit differently this year. We are so privileged to have Rick Willis, the CEO and president of the Brain Injury Association of America, and Jeff Lauer, our CEO, executive director of Brain Injury Alliance of Iowa, here with us today. And we are going to invite them up with Gene Shelton, On With Life's CEO, to give a little overview of what's new in neuro rehab from the national, state, and local levels. Test, test. Test. Test.
Thank you.
Thank you, everybody, for joining us today. I am so excited about this conference and can't believe we have these two distinguished gentlemen with us today. This is really a big deal to have both of the association, Alliance and Association, present today. And it's a very unique opportunity to hear from the experts about what's going on, not only locally, but in the nation. So I'm going to have both Rick and Jeff give a little bit of an introduction about themselves, and then we'll go into the content.
Well, good morning, everyone. Really a pleasure to be with you. I am relatively new to the brain injury community by profession. I've spent nearly 27 years in the nonprofit sector, so I certainly get many of the same issues that we grapple with here. But I've had a number of people ask me why the Brain Injury Association, and I, through lived experience with family members who have had both traumatic and acquired brain injury, have familiarity with the cause for sure. And as I was sharing at dinner last night, my dear wife of 26 years is also an OT, and so I've learned in the early days through the family experiences that we were unfortunate enough to have. I learned much of my formative understanding of the issues in brain injury. I actually learned through her educating me. So it's really a pleasure to be here with you today and to share more with you about what's going on more broadly in the space.
And good morning. Jeffrey Lauer, Iowan. Grew up in Iowa City, left, worked for a decade for Rick Shop, Brain Injury Association of America, as the National Director of Affiliate Relations, and then for the past about 20 years as CEO of the Brain Injury Alliance, what was the association and is now the Alliance of Iowa. I had the great good fortune of meeting with Rick yesterday afternoon, where the United States Brain Injury Alliance, which is one of two national organizations, and the Brain Injury Alliance of America sat down to talk about moving towards each other in terms of more collaboration. And so exciting times at the national level. That's one of the what's new in brain injury in the USA, as well as my efforts over about 27 years. I also have lived experience as a family member. Had a mother who's had acquired brain injury from stroke, and we have a daughter that has had 2 neurosurgeries for removal of a benign, but not undamaging brain tumor. And so going through the process of rehab is part of what we've lived through as well. Thanks, Gene.
Thank you both. Can you hear me okay? Okay. Just need to hold it closer. So one of the things that we wanted to really get to today was to hear from you what your thoughts are about what's new in brain injury on a national level. And then, of course, Jeff, you can speak to both the national level and the local level. There's a lot going on, a lot of churning going on in the state of Iowa, and I'm very anxious to hear from both of you on where you're at in terms of what it's looking like right now in the current state.
I guess I would point out a few things, and I'm going to lean to some policy updates for you that I believe will be very relevant to the work that you're doing, and that I trust many of you are probably more up close and personal with than even I am. But a couple of things that have occurred that I think are new. There was some surprising developments with regards to unified payment systems, and I trust that a number of you might know a little bit about that there's been some push in the recent years to unify across inpatient rehabs and SNFs a consistent reimbursement, and we at the Brain Injury Association of America have opposed that for a long time. We think that would be detrimental to patients, both in terms of the duration and the intensity and the scope of the rehab that they would receive. To our surprise, MedPAC actually, we were expecting that the Medicare Payment Advisory Commission would recommend that they would move forward actually in recommending changes to the unified payment system. To our surprise, they did not. And so that, of course, doesn't mean that there won't continue to be a push to change how payments to rehab. But I think a couple of the things that we do have to be thinking about, which maybe I'm jumping ahead and I can come back to later, but I think something that's on the horizon is there's been a lot of conversation. It's not new, but there's been some emerging trends to think about in terms of value-based healthcare, and I'm sure that you all have probably heard about that. That was something we talked about at the Brain Injury Business Practice College in January. So that's an initial thought. I'll pass to Jeff.
Wow. Let's see, vertical integration. Let me start at the national level with a couple of projects that certainly are not, they're policy, but they're kind of longer term policy related issues, and they cross over into research as well. Brain injury in the medical literature, rehab literature, community-based literature has seen a transition in the last probably 5 to 10 years where there was a discussion about brain injury not just being an event, but that you rehab from and you're done, but is a chronic condition. And one of the things that's universal, whether we appreciate it or not, is that, well, first of all, how many people in here provide care for and professional or personal care for, but aren't identifying as people with brain injury themselves? How many people are, okay. So, and I don't mean to diminish anybody else, but if you're fortunate, and we often call it unfortunate or fortunate, it's neither. Eventually, if you're fortunate, you will live into a time where you too have either sickness, disability, old age, and there's that thing that very few of us get out without dying. So those are classic and human conditions that we experience. You as caregivers experience them firsthand, typically closer to the time that people are experiencing an onset of a chronic condition, which is, we often say, so unfortunate. And yet, it is a classic human experience. And it has a trajectory which is now being recognized nationally by NIDLR, National Institutes of Disability and Rehabilitation Research, as well as HHS, as needing to have perspective of chronic condition, which in this case says rehab, which is early, intensive, and specialized, is key for good long-term outcomes. And that's the new piece, and long-term services and support to support self-management for living well with brain injury is equally important for good outcomes. And that piece about self-management is now being funded by the feds. There's a large-scale study that has collaboration across the country with a number of sub-grants, but it's spearheaded by the University of Indiana, as well as Ohio State University. I'm John Corrigan, who sits on your board, Rick, as I think the director specializing in research, is part of the team that leads that, as is Flora Hammond, a physician from University of Indiana. That effort to unpack what are the key areas for long-term self-management, which starts the day of admission, which I know is a focus for On With Life, for persons served, is critical. So those of you who are providing speech, OT, other kinds of therapy, physical therapy, with that issue in mind, that your essentiality of intensivity early also needs to continue long-term. And the Brain Injury Association affiliates, the USBIA affiliates, are working towards, if not providing services themselves, which in Iowa, BIA does. We provide neuro-resource facilitation. Where's our table, June? There we go. So can you raise your hands if you're a NERF? Or maybe stand up. I just want people to see you. If you have the ability to stand up, Chelsea, June. We've got folks here, and they're coming more later, who are our go-to staff. They're CBIS, again, another program from BIAA, Certified Brain Injury Specialty, and/or trainers, thank you. As well as they go deep in that issue of how do you navigate a changing, churning, and that's the piece I'll get to in a second, Gene, system. So self-management. In Iowa, what's going on policy-wise? Wow. This morning, Senate File 494 was announced that it was sent to the governor's desk. This is an example of an ideological intensity that is going on in the state. 494 is the SNAP, Supplemental Nutrition Assistance Program, food stamp bill, which will increase the accountability for people who have been accessing food supports in Iowa, decrease the eligibility, decrease the asset levels that you can have as a backup significantly, so that it's ensuring that SNAP benefits go more towards people who are in deeper poverty. And that's good from one perspective. We want to make sure that people have a need for food assistance. On the other hand, from another perspective, it also kicks a bunch of people off food assistance in Iowa, or it will. In addition, the economics of the process of increasing accountability far outweigh any savings. So in Iowa, the fraud around SNAP and Medicaid is very low, less than 0.1%. Maybe it's 0.07%. The point being that the efforts, the millions of dollars the state will invest and/or lose from the federal government by far outweigh any savings. But that's not the bottom line. And that's really one of the points that I'll come back to, Gene, is that we have a ideological intensification, not just in Iowa, but I know Rick and all of us see this across the country, where our ideas about what's right and why things are right are more intense, which changes the nature of advocacy, which I'm guessing is a question you have. So I'll leave that, not that SNAP is the one thing I want to talk about, but that ideological change is not insignificant.
Thanks, Jeff. And with that, you know, the state of Iowa has restructured, a significant restructure with Health and Human Services and other supports. So we're starting to see some rumbling and discussion about the waiver programs and what that means in terms of maybe a consolidation of the waiver programs or a rethinking of the waiver programs, of which, you know, brain injury is one. And so we're keeping a very close eye on that, and I'm just wondering if you've heard anything further about the waivers, Jeff, in the recent weeks.
Yes, and in fact, we've had direct discussions with HHS Director Kelly Garcia, as well as Iowa Medicaid Director Liz Matney. No promises from anybody yet. One reason is they're still waiting for the dust to settle from this session. The reorganization that's happening is so broad that although one of the things on their list to do is to consider the waiver issues, so is continue to absorb the Department of Public Health within HHS, the Department of Aging within HHS, and what is more, a much larger reorganization bill that just passed. So one of the questions they reasonably have is, okay, we've been told we're going to do all this. Are we going to do it with our current budget? Are we going to get to be more money? Are we going to have more staff? They don't know. And so in that space, we've stepped in and said, it's understandable why from one perspective, it might be logical to consolidate waivers into one mega waiver based on functional need. Brain injury is a horse of a different color, in that if there is not an assessment done for cognitive disabilities, at the very least after brain injury, you can miss stuff that would show up on other functional assessments. So people with brain injury won't have the benefit of having their caregivers be able to apply even basic education about why they might have impulsivity issues, why they may be, however you want to define it, what appropriate and inappropriate is, why they may be inappropriate. If I'm leaning over and just put my hand on Rick's thigh as I'm talking to you, and I don't know him that well, he's going to wonder, what's up with that?
I'm wondering what's up with that.
I know you do. I know you are. And this is not unusual, as you'll find. No, it is unusual. But my point being is that the things that we've learned about what is and isn't are not appropriate, as you know, nonverbal communication, use of space, how long Jeff talks before he gives Gene the mic back, all those pieces they're not written out. We learn those based on who we are when, what the appropriate situation is, whether you have people who are or paying attention to you. All those components come into play. If you don't know enough about the brain and brain injury, it's going to be hard to establish rapport with people we serve. So the two pieces we've asked for are consideration for not just consolidating the brain injury waiver in, but expanding. And having two waivers, one that's a brain injury rehab waiver that would have intensive outpatient supports, PT, OT, and speech, for 6 to 24 months. And then more of what we have right now, which has evolved into a long-term service and support waiver. How do we support people to live well in the community? And the response we've had from them is, that makes sense. Is that what we can do? Time will tell.
Well, thank you both on that. You know, one of the things that is close to our hearts at On With Life is life. You know, the fact that this is not just a disease or a condition or an event, but what is quality of life? What is the future for those that we're caring for? And so this is an extremely important topic for us as we navigate through how do we support all of those that we serve. And I would guess that most of you in the audience have those similar feelings. It's not just an assembly line type of care system that we have, but how do we improve that lived experience? How do we make it a meaningful life? I guess make it's not the right word, but how do we facilitate the best opportunity for those we serve to live their best life? So as we look to our role in your roles as clinicians or carers, one of the things that we have to get better at, and I know that I have to get better at, is advocacy. And so I'd like to hear from the experts on what's the future look like for, and what role should we all be starting to assume in terms of advocacy for brain injury?
Well, there's a lot that I could fold into that question. I guess I would say a couple of things. I think one is, I think we have to recognize, as I believe we all do, but we have to recognize the power of the voice of the brain injury community in affecting change and influencing change. And so just a couple of things I want to say on this. One is you may or you may not be aware that every year in March, the Brain Injury Association of America, in conjunction with our partners, USBIA, NASHA, the National Association of State Head Injury Administrators, hosts an awareness day on Capitol Hill. We had that this past March, and really focused on appropriations, so continuing appropriations for the TBI programs, so this is the federal money that flows to the states to support local programs, as well as the CDC's concussion surveillance program, which was authorized by Congress a few years ago, but not fully funded. The reason I cite that is because the way that those changes happen, what goes on at Awareness Day on Capitol Hill, is it's advocates. I had the privilege, I think was the right word I want to reach for, of really walking the halls of Congress with a woman from Texas who had suffered 4 strokes and of course had the subsequent acquired brain injuries as a result, but telling her story to legislators about the importance of these programs, and nobody can replace that story. So I think that in terms of advocacy and the role that we can play, I think one is recognizing that that's how change happens. That's how change happens, is by the power of the voice of the brain injury community. And I would say that one thing that you here in the room, whether you are clinicians or whether you are on the operations or the business side, I think the important thing that you have to recognize, and that I know and that you know, is that many of those who suffer brain injury, they can't use their voice to adequately articulate what their needs are, what their future looks like, you're their voice. And so I want to encourage you that in the work that you're doing and the connections that you're making with those who are affected, you might feel, hey, Rick, we're a few thousand miles away from DC, in case you haven't noticed. Like, what's the impact that I'm going to have, at the grandest level, and certainly, here at the state level? And I want to encourage you that it is that you are the ones who know what their needs are. You speak for them, and you're a member of the brain injury community at large that has collectively a powerful voice to influence change. So I just want to encourage you to not undermine that work. I would like to come back and comment more on community, but I'm going to pass the mic to my illustrious colleague.
Well, thank you. Thank you, Rick. The issue of stories and heart data cannot be underplayed. There is no question that we make meaning out of telling our stories. And your story, not for people with brain injury, but with, if you will, and asking them, may I share your story as an example? Your ability to articulate to a local policymaker in your local community, which means that you can relatively easily find on the Iowa Legislative website when and where on a Saturday morning or a Thursday evening your local legislators might show up. And if you show up once a year, and get in line or put your name in the chit for asking a question, or just saddle up afterwards and hand over one of your favorite blueberry muffins that you've made, and they're not worried you're going to poison them, typically when they get them locally. It's only when they get into this, come by mail. In any event, when you make a connection and are able to say, I work hard in this area, people are struggling, we need you to have an attention to people with, and then fill in the blank, disabilities, local people with brain injury, people with cognitive, in wherever you see that essentiality for intensive, specialized services and access to that as a critical piece to recover well from brain injury in addition to long-term supports. Now, why? Long-term supports, the part of the heart story is you will know people who have lost their jobs as a result of having brain injury or lost their jobs as a result of caring for somebody with a brain injury, and they are now on a financial track that is less stable, which increases their probability that they may have to apply for Medicaid. Now we're moving it from heart data into hard data and talking about what are the costs of having somebody who maybe, we'll use a four-person family, have all four people need to go onto Medicaid. And the average cost per year for somebody with a brain injury is about $18,500. For a family of four, it's maybe $25,000 to $30,000. And let me answer the question, how long do people stay on Medicaid? We don't know that they come off. There's no good data about when people come off of Medicaid. Most people stay on Medicaid for long periods of time. That adds up to real money. So I'll just speak to this issue about what we've found from a policy standpoint here, that just the small program in Iowa, the Brain Injury Services Program, returns the state 107% return on investment. So for every dollar, you get $2.07 back. And what we talk to legislators are, once we've told the hard stories, is where are you going to get a return on investment like that? And that doesn't count the federal money. It doesn't count the savings from people who might end up in prison or homeless or in psych-in placement or an expensive out-of-state placement. Those are all additional costs that make it rise to 220%. But our legislators, when they get down to it, it's like, no, I don't want to hear who else just tell us about the Health and Human Service budget. So these are the kinds of changes that have been made, that vertical integration, telling your story locally, and then reaching out or having us push data on what's available. That last piece too, Gene, and I think you talked about consolidation, and Rick, you talked about CDC with data. We don't have data in Iowa like we used to. Part of the starvation of HHS and IDPH has been in a stripping away of the ability to track brain injury surveillance data, incidence and prevalence. So we have to extrapolate, and we depend on BIAA and other national organizations to make sure that there's fundamental support at CDC for data that we can use to extrapolate to our population. So we, again, can use the data to drive policy, the policy that drives funding, the funding that drives services.
Rick, do you want to talk a bit about community? You mentioned that before.
Sure. I have what I believe might be the unique opportunity of maybe fresh eyes, if I can use that expression, being relatively new to my role. I certainly am familiar with as I alluded to earlier, the issues that in what I would call voluntary health, in the voluntary health space, there's some commonality in issues in terms of reimbursement and advocacy and those sorts of things. But I would say that I've had if I could just speak for a moment about my own personal experience, I've had a front row seat over the years, to people who are dealing with terminal illness, the death of a child. They are dealing with chronic pain. They're dealing with lifelong disease management that presents devastating costs. And in all those situations, they're trying to navigate our healthcare system. They're trying to seek reimbursement from their insurance companies. So I've had an up-close and personal perspective on that, as I'm sure many of you have in my career. And an observation that I would make is that, I've had people say to me, I want people to understand what brain injury is. I want them to understand that no two brain injuries are alike. I don't want to walk into an environment and not have to explain what brain injury is, that maybe I look fine on the outside, but I'm challenged and I have some difficulties, that I'm working through, but I don't want to have to explain that. I want people to understand that. And I would offer that in terms of my outlook for the Brain Injury Association of America and the Brain Injury Association at large and our partners collectively, that my observation is that the organizations that don't have to explain their cause, that we could name some. We could name their logo, we could name their look, we could name what they're about, we could all probably name a few. And I would argue that those organizations are the ones whose communities came together to speak with one voice and to affect change in that space. I, again, could have been a part of some of those. And I've seen the power that community makes. And I would also argue that some of the issues that I've heard a lot about here that I think I'm not surprised by, but that I feel passionately about, are gaps in the continuum of care, for instance. And I've seen the power that community makes when people know where they can turn for help, when they know that they can talk to someone who's been through their journey, when they can get advice on how do I navigate my health care, how do I navigate our healthcare system. When they know where they can turn to get that advice, and then they have a place where they can also say, I'm going to take control of my own healthcare by getting involved and doing something. To me, that is community. And I would argue that the organizations that we all, besides the one that we're involved with here today, but that we also respect because of the difference that they've made in their space, it's been the power of their community that has done that. And so as I look ahead for the brain injury community and the Brain Injury Association of America, I believe there is an incredible opportunity for our community to come together and speak with that one voice and to affect that change. And if there was one thing that I could leave you with here today, I feel like I'm not saying it well, and I really want to come through the mic, is that each of you are a part of that community. And I realize that in the day-to-day work that you're doing, you do it because it's a labor of love. But I want you to also understand that you're doing it as a part of a community. And I think that the more that we can come together and recognize the power of that community, the bigger difference that we're going to be able to make.
Wow, thank you so much. I think we've run out of time, which we had a couple more questions. So if you were finding this discussion to be of value, please connect up with any one of us after the event or during one of the breaks. In the meantime, you're going to hear a presentation about caregiver burnout and professional burnout. And I think one of the contributing factors to that is hope or lack of hope. And when you start thinking, oh, well, this is just, that that experience that you're hearing about on a day-to-day basis. If you don't connect up the hope, which I think advocacy applies to, and if you get out and start advocating, I think that's a big part of re-energizing that level of hope for the field. So that's my plug, and I want to thank you so much for your time this morning. I want to thank our guests. This is a very unique opportunity to have had them both here together, and thank you so much for your time.
Thank you both.
Thank you.
Thank you so much. This next presentation is brought back by popular demand. We've heard from you in your surveys that you want very tactical things that you can take back and put into practice tomorrow or Monday. And that's what this is. So 5 and 50, we're going to give you 5 short presentations over the next hour. And I hope that from each of them, you can take away maybe 1 or 2 items that you can implement into your practice. I also want to make one quick mention. I apologize to our friends online. We had a couple technical difficulties. Everything should be up and running now. If you missed the beginning of that, it is recorded. You can go back and watch it later. So I apologize for that. Everything should be working now. Kenzie and Krista, come on up.